Now, back in 1918, there were no antibiotics, no antivirals, no vaccines. And so since then, there is a huge level of complacency.
We're beginning to think that we can beat any illness, and we can't.
Climate change, global conflict and increasing levels of migration and global travel increase the risk of diseases.
We're now facing health matters that are absolutely crucial.
I think the actuarial science is there. We have statisticians telling us that we're overdue for another pandemic.
I think it's almost certain that we're going to have one because we're getting very careless in many ways.
I think it's very real.
I think there's a real risk.
I think it's less a case of if it's going to happen and more, are we going to be prepared for it when it does happen?
The problem with diseases of this type is that there are many aspects to them. So you have to do information for healthcare professionals, you have to do better quality vaccinations and vaccines, you have to do better quality information for people.
Government, the industry, all of us have to try and spread that message.
The main reason that infectious diseases spread is from person to person, either through coughing and sneezing or through hand contact. So people are aware that there's a very easy way to prevent infections, i.e. wash your hands, then that will actually stop the chain of infection.
We, each of us, as citizens, have an obligation to ourselves, to our families and to our communities.
Whilst the challenge we face from infectious disease and antimicrobial resistance is global, and it is a tremendous challenge, there's something that everyone can do. Normal members of the public can ensure that they prevent infectious disease by washing their hands, by not asking their medical professional for antibiotics when they don't need them, and by getting vaccinated. Healthcare workers can emphasise the importance of those things, not be pressured into prescribing antibiotics unnecessarily, and encouraging the people they see to be vaccinated. And governments can provide funding for us to invest in new antibiotics and mass vaccination programmes.